Rome, March 15th, 44 BC. The theater of Pompey. Julius Caesar stands among senators. Within seconds, blades appear. He is stabbed once, twice, 23 times. History says only one wound was fatal. But here's the question no one asked. If a modern trauma team arrived within 5 minutes, would Caesar survive, or was he already beyond saving? The attack wasn't surgical. It was chaotic. Different angles, different depths, short Roman daggers, no coordination. Blood spills across polished marble. But something important. He didn't collapse instantly, which means one thing. The heart may not have been destroyed immediately. So what actually killed him? Ancient physician Antistius examined the body. 23 wounds, only one described as fatal, a chest wound. But fatal doesn't mean immediate. There are 3 possibilities. The blade pierced the heart, it severed a major vessel, or it collapsed a lung. Each changes everything, and only one gives him a real chance. In trauma medicine, time is blood. The first hour is called the golden hour. If a trauma team arrives within 5 minutes, they secure airway, they stop bleeding, they stabilize circulation. But there's a problem. There is no hospital. He's lying on the Senate floor. Where do you perform open chest surgery in ancient Rome? Let's assume they try anyway. They intubate him, insert a chest tube if the lung collapsed, open the chest if necessary, clamp bleeding vessels, begin transfusion. And here's where reality hits. He needs blood, a lot of it, and Rome has none. The average adult has about 5 liters of blood. Lose 2 liters, shock begins. Lose 3, organs start failing. 23 stab wounds could drain him in minutes. Modern trauma teams use massive transfusion protocols, packed red cells, plasma, platelets. But even if they brought some with them, it runs out, fast. And what if his blood type doesn't match? There is no lab, no cross-matching. One wrong transfusion and he dies on the table. If he survives the bleeding, let's say they stop the hemorrhage, repair the lung, close the chest. He's breathing, he has a pulse. He survived the first hour. He's not safe, because Rome in 44 BC is not sterile. Dust, fabric fibers, open wounds, no ICU, no ventilator. Infection doesn't kill immediately. It waits. What kills him 3 days later? And then there's something medicine can't control: power. Caesar is the most powerful man in Rome. The conspirators are still in the building. If word spreads that he's alive, does someone finish the job? Does chaos prevent treatment? Medicine works inside systems, and the Roman Republic is collapsing in real time. Even a perfect surgery can fail in a broken system. 3 possible outcomes. Scenario 1. The blade pierced the heart. If the left ventricle was perforated, he loses consciousness within seconds. Modern survival rate? Extremely low. He dies. Scenario 2. The lung collapses, but the heart remains intact. With rapid intervention under 10 minutes, modern survival could exceed 60%. He lives. Scenario 3. Most wounds are superficial, but blood loss is massive. Survival depends entirely on transfusion speed. Run out of blood, and history remains unchanged. In a modern trauma center, his odds might be reasonable. In a Roman Senate chamber, no sterile field, no backup blood bank, no ICU monitoring, no safe recovery. Environment reduces survival more than injury sometimes. And Caesar didn't die in a hospital. He died in a political storm. So could a modern trauma team save Julius Caesar? If they arrive immediately, if the heart wasn't destroyed, if they brought sufficient blood, if they secure the scene, then yes, possibly. But if even one major vessel was severed beyond rapid repair, if shock progresses too far, if chaos interrupts treatment, he dies anyway. History doesn't turn on wounds alone. It turns on timing and systems, and on whether the world around the patient is ready to save him. Rome wasn't.